Okay, you guys ready? Show in the room? Okay, good afternoon. I'd like to go ahead and call the Children's Trust of Alachua County April 29th meeting to order. We've got some distinguished guests from around the state, and so the county has made this particular meeting available online. So it's being recorded. It's not live because there's other things going on Channel 12, but hopefully we will be able to make this video available in the future online. And so I think if we can continue with that, that would be great. But with our special guests from around the state, we wanted to make sure that we captured live and in color for future reference for our public and for our members. So calling the meeting to order, the first thing on the agenda is the adoption of the agenda. So I'll take a motion.
Second.
A motion and a second to adopt the agenda. Is there any discussion? Anyone from the public wish to speak to the motion? Bring it back to the board. All those in favor say aye. Aye. All those opposed? Motion is approved. Next item is the approval of the April 15 minutes. I had a minor change on there. Item 7, last sentence. I think Mr. Hutchinson was talking about our budget, first year fiscal year budget, and Mr. Hutchinson reiterated that no official decisions are legal until October 1st. So any decisions made by the board are tentative and can be changed at any time. Hopefully the decisions we've made will continue to move forward. So if I could just suggest that we say our budget will go in effect on October 1st and can be changed up until we had formally adopt the budget. That would be my only change. Are there any other changes from the members? With that, I'll take a motion to approve those minutes.
So moved.
Motion and a second to approve the minutes as changed. The one thing I did have a question there for staff is on that same item, it says a draft interlocal agreement. Do we expect to have that back to us at our next meeting, or is that, what's the timing of that? Mr. Smart?
Mr. Chair, yes, we plan to have that draft interlocal agreement for the board's consideration at the next meeting.
Okay, so we've got a motion and a second to approve the minutes from April 15th. Is there any public discussion? Bring it back to the board. All those in favor say aye. Aye. All those opposed? That motion is unanimous. Okay, now for the main event. Mr. Smart, I will let you do the introductions.
Mr. Chair, we are very fortunate to have with us today executive directors of the Children's Services Councils of St. Lucie County and from Martin County. From St. Lucie County, we have Mr. Sean Boyle. All right, sorry. Mr. Sean Boyle, and also it's David Heaton from Martin County. So they're here, and they're going to come up one at a time, of course, and talk through their programs and how they got started and hit some high points that you've already asked about. And then we'll open up for questions for each one of them. We also have representatives here from the Florida Children's Council, and they'll come up after Mr. Boyle and Mr. Heaton get a chance to go through.
Okay, thank you, Ms. Smart. So, Mr. Boyle, Mr. Heaton, I had the distinct pleasure of meeting both of you in Tallahassee. I really appreciate you being here. Just so that you understand who you're talking to, we're the current board. The governor, we are waiting on the 5 appointees from the governor. We have submitted 15 names for the governor to consider, and many of them are here today, and they're in the reserve seats over to the side. So the way we thought we would do this is ask you each to give a presentation, and then we'll do kind of a panel situation. And during that time frame, we would ask our appointees to use this microphone, and one at a time, feel free to ask whatever questions you may have. Certainly wish you were sitting up here with us, and I think it's important that we kind of capture that information, and then we'll obviously open it up to our board to ask you all questions. But we're really here to learn from your past experiences, and hope that's okay. Appointees, is that okay if we do it that way? All right, so with that, I guess, Mr. Boyle, do you want to start us off?
I'm going to default to Mr. Heaton.
Okay. That's
I've
a
done this many times. He always goes first.
good move. Good move. Mr. Heaton, welcome.
Well, good afternoon to everybody. Can you hear me okay?
Yes, sir.
It's a pleasant 4-hour drive up here, so we've had time to sort of chat, Sean and I, and he said, as he just indicated, we've done this a lot lately, and it's certainly our pleasure to come up and do whatever we can. I know we talked with you and Claudia in Tallahassee and shared a little bit on the fly, but certainly appreciate this second level opportunity to come and actually talk to you in your current configuration. Met some of your people that are waiting for dance partners out here that would love to get up there with you all, and I'm sure that'll happen in time. We have blanketed you with paper. So I know that you've read every line of all of those documents in your packet, which look to be in excess of 100 pages. So what I think
Typical from our
Yeah.
staff, yes.
that will thin out as you start working
Yes.
on some of the things I know you're going to get into. What I would, and I think Sean and I would benefit most from, is just being given an opportunity to find out what you don't have answers to, what you haven't been able to find answers to in all the information that you've been given. I would appreciate any opportunity to answer questions that have not been answered. We've talked with several of your community members, had some very exceptional questions, I think exceptional questions from a very interested community. So I congratulate you, first of all, on being so engaged, having a connection with your community, because I think that's vital to getting started right and to getting configured correctly at the very beginning. And I know that's your agenda here, is to get as many answers as you can to benefit certainly from the experience of the Children's Services Councils across the state. We have today the Florida Children's Council, which did not even exist when Sean and I were first configured, or our councils were first configured. So I can recall going to Sean's board, not sitting in a formal setting like this, but in a rather informal setting, and having a very similar conversation, because they had just gotten started and they had similar questions. I can remember being at the first board meeting of the Children's Services Council in Martin County as the representative from then HRS, now DCF, and Jim Mills, who was the director of the Juvenile Welfare Board, and Barbara Kaufman, who was the executive director of the Children's Services Council in Palm Beach County, who was less than 6 months old at that time, came to speak to us and spent virtually the entire meeting answering questions, going through, how do you do an RFP? How do you hire staff? What do you do first? How do you establish your budget? All the same questions all of you are asking. So rather than take a whole lot of time answering questions we've already answered on paper, I would like to just give Sean an opportunity to come up behind me and then get immediately
In the
to
panel.
your questions, if that's okay with you.
Yes, sir.
I think that's
wonderful.
time well spent.
Yeah, I think that's great. Thank you. Hey, Sean.
Hello, thanks for this opportunity. Dave and I, when he came to pick me up, I was like, yes, we're both wearing blue suits. That won't look weird. We forgot the orange though. But, and to Dave's point, when we got the questions that you wanted to address, and, when I heard 10 minutes with all those questions, like, there's no way that, I can talk fast, but not that fast. And I literally provided you with an outline of everything that I would tell you. So I can hit upon some of those highlights, and I too also apologize for contributing to the length of your packet. I don't think it dawned on me when I sent you my annual report and our program accountability report and everything that you would be walking in with a 150-page packet, so I apologize for that. I was not here when our Children's Services Council was voted in October of 1990. I came in 1997. So I've had several calls with several people from your county in the last year. This is the second time that I've been up here. I met with your advisory council, and I even had a couple of calls last week. And in the questions that they asked and that you asked, I actually had to do a little bit of digging because I wasn't there. So you guys are kind of in that awkward position, right? You're voted in, you have no money because you have to wait for the next go around with the truth and millage process and all that. So what do you do? So I looked up what our Children's Services Council did, and you have this all in writing. And I'll step out of the way, but just to let you know, there was an interlocal agreement that was signed, I believe March after that October. Again, they did not have money or staffing. The interlocal agreement, I provided you a copy in the packet. It details specifically that the county administrator and his staff designated to provide administrative and clerical assistance until an executive director was hired. I do know from, because I've met him, the first director of the Children's Services Council, that's what we are called, you guys are called the Children's Trust, was the assistant county administrator, acted as the first Children's Services Council director. His administrative assistant also served as staff for the Children's Services Council at that time. It also authorized the Children's Services Council to use the county's legal services, to also go through their purchasing department for that year, and it included a line of credit up to, I believe, I want to say it's $125,000. Now, keep in mind, this was back in October of 1990. So 125,000 isn't quite what it was today. I do know from the history, the second year of which they did collect money, because, you know, our fiscal year is October to November. When you go through the truth and millage process and you levy the ad valorem revenue, you're not really going to see that until November, probably at the earliest. So that's where that line of credit also came into play. I do know in that second year, mostly what they did, and I know this, I have the annual report for 92, 93, so I can tell you everything that happened in there. But in the second year, they did a couple of things. They secured a separate location, so they actually had their own offices. They acquired legal services, and they had built out in that transition year, between October 1990 until the following year, they had built out who their dance partners were. They'd figured that out. They'd built out the bylaws and had started to develop the funding plan. The first full year of funding, what they funded was staff. They hired an administrative assistant, an executive director to start. They eventually hired a resource director. But what they did was they invested in, and it sounds like you guys are already ahead of the game, they invested with FAU and FIU to do a comprehensive needs assessment and medical assessment. And I say medical assessment because one of the big needs that was facing our community at that time was infant mortality and uninsured. So that was their largest investment, and they actually did start small programming in the second year. In 92, 93, they had a $1.2 million budget based off the needs assessment. They funded 17 programs, and we've grown since then. But just to kind of give you a scope, we do still have an interlocal agreement with our county. That interlocal agreement is the same interlocal agreement that they have with all the independent or the constitutional officers, which is we are signed on to their health plan, their health benefits. So it's an interlocal agreement so that we can share, because we're a team of 10 people, or 9.5 actually. And so that's a great benefit to us as an organization to have that. That's been in place since we started. I gave you a copy of the renewed one that took place a couple of years ago. I can go way in deeper. I can tell you that one of the strategic things that we did that I would highly recommend that you do is when we started off funding, we funded 17 programs, and we would do open competition every year. Open competition based off a needs assessment that was from 0 to 18. And what we found was that when programs get funding for 1 year, or will get funding, it usually takes them a year and a half to get started and to actually show outcomes. And to have them compete every single year was actually kind of counterproductive for what we were trying to do. So we have 5 priorities. And I say these 5 priorities 100 times a day to anybody that will listen. And we purposely restructured them to be in language that people who don't work in the field can understand. So our first priority is making sure every baby's a healthy baby. Second priority is stopping child abuse before it happens. Third priority is keeping kids off the streets. Fourth is keeping them in school. And 5 is keeping them off drugs, alcohol, and other risk behaviors. I'm going to end with, because I know you have lots of questions and I can talk forever. I'm going to end with, when we did our comprehensive needs assessment, it looked at community indicators, and it also did focus groups and surveys. Those community indicators that they looked at, those 19 or 20 or so indicators, we have continued to follow them and update them every single year. So when we put out our categories, those 5 funding categories are tied to community indicators. So, for example, making sure every baby's a healthy baby. A funded program has to come and apply and show that their program will impact either access to prenatal care, infant mortality, immunization rate. I think there's 3 or 4. If they can't demonstrate that in their application through their research, that is the one disqualifier we have. We will not fund that program automatically. So all 5 of our programs or categories are tied to the same community indicators. So as a board, we look at those indicators every year. you don't want to react to, if infant mortality spikes in one year, you want to look at trends. So we continue to look at trend data every single year as part of our board process for strategic direction and funding decisions. I'll stop talking because I know you got questions.
Okay, that's a great overview. I'm gonna ask our advisory folks to kind of make your way over to the podium. I know you have lots of questions, but, Judge Bullard, did you wanna
Well, we can
start
stay
off?
with that order.
Okay, you wanna start with them? Okay, so why don't, so thank you for that overview and for all the backup that you provided. You wanna start with our advisory board folks? You have any questions for our panelists? I know we do, yeah, there we go. Get this thing started. And we've allocated the first hour of our meeting. This is really important, so don't feel like you have to rush. Feel free to take your time and get into those details. Yes,
All
sir.
right. I've got 3 questions, Ross Ambrose, by the way. And I'll just throw them out there and you can answer them. One of them, I looked at your millage rate since '92, and actually in 3 instances, you actually lowered the millage rate and you've never maxed it out. So given that I always kind of think there's more need than there's ever amount of money, how have you just not gone ahead and maxed out the millage rate and then done the most with what the voters authorized? So I'm a little curious about that. The other question I had was from an innovation standpoint, in terms of doing something really unique, what would you say that you've done that's most unique with the dollars you've received? And then how did that program or whatever it was come to light? How did you foster something new and unique and different to show up for the money to be used? And then also, the material shows there are a lot of successes and that you've made an impact with what you're doing. I'm just curious, looking back over all the years, is there anything that hasn't worked or a path you would definitely want to avoid?
Thank you,
So-
Ms. Ambrose.
Thanks.
I feel like I should have I can't do this right because my back's to somebody.
Well, if you'll just speak to us, they can see you up there.
Okay, perfect. First question, maybe we'll tag team these questions, I don't know. Martin County is a very conservative place. The millage rate started off in their first year at 9 cents. They decided early on that they would not release any funds in the first year of their existence. They wanted to put the money in the bank and then make their funding decisions based on a plan and only fund what they had resources to cover. So the first year they collected, off the top of my head, just shy of $1 million. And they allocated $500,000 to the community under some very broad funding priorities, which you have in your packet. The needs assessment they used was at that time something that had been done by the community and driven by United Way. As Sean said, we borrowed about $100,000 or got a line of credit for $100,000 from the county, borrowed some furniture, rented an office. I can remember sitting with the newly hired executive director who came from Wisconsin and a administrative assistant who came from the county in a room with 3 chairs and talking about, we get to start this thing from the bottom up, literally. We have nothing and we get to start today. So who wouldn't love that? I mean, that's a huge privilege and an honor to be able to start an organization from the very beginning, do it right, and I know that's what you're trying to do because I can tell by your questions. But you asked about how our millage rate ebbed and flowed. Generally because of that guiding principle that was established very early on, that they never allocated more money than they had, and then their planning was driven by what was the funding was driven by the planning. So it ebbed and flowed somewhat based on taxable values in the community we have, and you may have the same kind of configuration here. But we have an organization called the Martin County Taxpayers Association. They were very interested in what we were doing. They had a keen interest in any government entity that had taxing authority, and in particular ours, because the configuration was not something they were used to. It had, as you all know, 5 seated positions that were partially elected, some not, some elected, and then 5 gubernatorial appointments who were not elected. So they were immediately suspect of that configuration. So there was an awareness of those concerns, and I think the notion that, all right, we have responsibility to the children in this community, we have a responsibility to the young families in this community, but we also have a responsibility to the shareholders, the taxpayers, the people that will be funding this organization. So they took that very seriously. Our millage has gone from that initial 12 cents to 36 cents in 30 years. So up and down, when values were high and you're taking in lots of resources, there was some rolling back of the millage to the rollback rate, perhaps. You'll understand, well, those of you who are in county government already understand rollback, but the County Taxpayers Association was immediately on the phone if they saw a rate increase notice in the paper, and had a conversation with the executive director at that time, and certainly with myself, about the justifications for that. So they saw themselves, and they continued, the Children's Services Council members saw themselves as stewards of community resources, stewards of programs for children, and those two responsibilities have been keen and foremost among their concerns for 30 years and continue to be. So I'll let Sean take the next question.
Innovative uniqueness to the program, what hasn't worked?
Good, then you get to do the one that hasn't worked. I like that. So real quick about the millage rate, because you bring up a good point. Like, why don't we just go to 0.5? And, you know, and I can know from working at the Children's Service Council since 1997, a lot of that is capacity of your community. You know, just because you have all this money doesn't mean that there's providers to provide all that. I know we started to run into that. And also capacity of your team to make sure that you're managing all those dollars correctly. We are this close to the cap, and our board purposely doesn't want to go to the cap because a couple of reasons, and Dave very accurately says there is a political aspect to it, whether you want to admit it or not, because it is a taxing entity, and I don't mean that in a bad way. There is just that outfall, and you have to look at the impact on the taxpayers, but also having gone through the crash, you know, where we lost, you know, 12% of property value, 15%, and then 21% consecutively. If you don't have any room to grow, you're really at the will of the ups and downs of the property value. So they purposely have left a little bit of room for that purpose. Most unique program, you know, when we go in on a program, I like to think that they're all unique because that's why we're going in on them. But there's a couple of instances that came to mind. We are currently right now a 4th partner with our county, all of our law enforcement agencies, Allegheny Franciscan Foundation, the Hunt Foundation, to fund a gang intervention initiative, which is a little bit deeper end than what we're traditionally used to. We're used to funding prevention, but basically what they do is they've identified, we have, it's a best practice model that we've carried on past the federal funding, which is unusual. From what I've understood is basically they've identified through the Department of Juvenile Justice and our community partners, we have 4 case managers, so about 100 kids that have either been arrested for violence or a suspected gang member of violence, and basically it's a case management program to make sure that they meet all their court appointments, make sure that they're getting off probation, more importantly, getting out of gangs and out of violence. And it's a tough program, I'm not gonna lie. And traditionally, to be honest with you, when it first came to our community, our board was like, we don't want anything to do with it, because we always assumed that the gang members were gonna be 18 to 24 years old, and it started off that way, but now there's kids as young as 10 on there. And it has a high success rate, and part of the reason why we only came in at 100,000, it's a 300,000+. We used our money. They were in a spot where the federal government, you know, federal grants only last 3 to 5 years. That money ran out, and it was at a spot where it needed to be continued, or it was gonna fall. It had too big of an impact on our community. But also, I did not feel, and I say I, meaning the Children's Service Council of St. Louis County, did not feel that it should be our burden alone to carry, because there's an impact on the community, on economic viability. There's a law enforcement. So we put up $100,000 with the idea that other entities would match our $100,000 to get that funded.
Very good. What hasn't worked? What do you, well, that was the last one, what?
Oh, what hasn't worked? Oh, that's Dave's turn. That's no. I mean, there's a whole history. I'm just messing with you. There's a whole history of. I mean, I don't mean to brag, but we have standards. We have accountability standards. We have fiscal accountability standards. We fund on a reimbursement basis, so they have to be financially aware and be able to process that. We'll work with that if they have cash flow issues, but I need to be able to go back to the taxpayer, as Dave said, and say, I can account for every single penny that we spent. And if you don't believe me, here's the file with whatever program you want. So we have had programs that have failed to meet that standard, or they fail to get an audit completed. There's contract requirements and accountability standards we have to meet up to. If you can't meet up to that, we will terminate your contract. Probably one of the failures outside of compliance, we tried to replicate a fatherhood initiative that was very successful in Martin County, and it just didn't take off in our community. For whatever reason, the fathers just weren't going to it, and we eventually, and it was sad to say because I was very much behind that, because fathers do need to get more involved, but we had to close the program down. Even though we thought we were replicating a very successful model that was just south of us.
Very good. Yeah, hey, go on up there. Yeah, just make a line. Elizabeth, go ahead, and then Harlan, you can go next. Go ahead.
Do I just talk?
You just talk. Just introduce
Thank you
yourself
for
and-
giving us your 5 priorities. I think that's a really important framework for any initiatives that you're looking at funding. And you mentioned the United Way had a needs assessment that you used. And so there was an existing framework for what was out there that needed to be addressed. How often do you feel like you need to update that? And how long do you give programs when they may or may not be working out the way you had anticipated?
I think we're similar in this way with St. Lucie County, but we have a 5-year cycle. We do a strategic plan, a community-wide strategic plan every 10 years. We do a strategic plan for our organization every 5. And during that 5-year period, we release one of our funding priorities for competitive bid each year. Our priorities are broad: healthy children, safe communities, strong families, success in school and life. There are sub-levels to those priorities, but in general, so when we release a priority that is a competitive bid, everyone who's currently funded under that funding priority gets zero-based, and they all have to come back in. In between those years, you're in essentially, if you're in compliance from a performance standpoint, you're meeting your performance measures, you are in what's considered a continuing contract status. So you receive whatever allocation you received in your initial year of funding under the priority release, you receive that for 4 years. In each of those years, we do kind of a mini needs assessment around the priority that we're getting ready to release. So kind of a touch base with the community, not a grandiose, full-blown needs assessment, but an evaluation of what programs are out there, what's successful, what's not successful. The second part of your question was? How long? Well, that should have answered that. So generally, if you're in good standing, we have programs that were funded in that first year that are still active. And I'll go back to the previous question in terms of successful programs, and Sean didn't talk about this, but one of the programs that we talked about before the meeting started is what we call the BRAIN program, but they call the nurse home visiting program, where every child who's born in Martin County is visited by a pediatric nurse within 2 days of leaving the hospital, and then given the option of a developmental assessment and a developmental visit within 2 or 3 weeks. So that is every child born in Martin County and every child born outside of Martin County that lives in Martin County. So anybody here's parents in here, you know that that first child you bring home, you have nothing but questions. You have nothing but trepidation about, am I doing this right? So how wonderful is it to have a nurse come in who's been there, done that, came from Scotland, raised millions of kids already, and has so much experience that she can tell you, well, yeah, he looks a little yellow, so yeah, he could be jaundiced a little bit, but here's what you do about that. Take him out in the sun. You know, it's not anything to freak out about. That program, I think, is not unique anymore, but when we started it, it was. There were, universal home visiting didn't exist in the country. So we feel like that was an excellent approach to making sure that, as Sean said, all of our babies are healthy babies. They all start right. All these families have the tools they need when they bring those babies home to get started right. And they get in their brain bag essentially a letter from the superintendent of schools that says, welcome to the class of 2025. So lots of good things. That program is not unique anymore, but it certainly was then. And that, I think, is the benefit of these kind of organizations, is you can think outside the box. You can do things and you can invest in things that the local community thinks is important. You don't have to do what everybody else does.
I have a question. I'm Bruce Ferris. In Alachua County, there used to be Big Brothers, Big Sisters program, and that's been gone for a while now. I don't think there's anything that's really replaced it, but I see a very high need for that type of mentoring. Has your organizations been involved with any sort of mentoring or Big Brother, Big Sister type program?
Yes, we fund Big Brothers Big Sisters specifically not just for mentoring, but we actually fund them to provide reading mentors from pre-K through third grade with the outcome of improving reading scores for the kids. We don't fund their traditional mentoring program. And then in addition to that, for example, the gang program that I brought up, we consider that to be a mentoring program. But that's our current relationship with Big Brothers Big Sisters.
We also fund Big Brothers Big Sisters. In fact, they just came in under our released priority for school to work with a career skills program. They've been operating and funded in Martin County for 15 years by us, funded by us for 15 years.
Hello, Karen Colesmith from Santa Fe College. You talked about your responsibility to stakeholders. And so my question is, how often do you go back into the community and give the report on how well you have done? And how do you ensure that a cross-section of the community gets this information? I think you well know so often we're preaching to the same people. We're singing with the same choir. And so just want to make sure, what efforts have you made to ensure that the cross-section of the persons in your community get the information and hear about not only the successes, but also the challenges?
I don't think I could plan it a better question. So this is one of my things that I am adamant about. I believe as a funder, and boil it down to, what do we basically do? We convene, we bring people together, but the bottom line is we fund programs to make things happen. As a funder, we ask all of our agencies to follow best practices. There are best practices for funders, which includes engaging the community in what you're doing. Not telling them what you're doing, but engaging with them. So we are in an evolution to make that happen. It's been something that I've been talking with my board about for a while. It was hard to talk to them about it when we're going through a recession, but I do now have a director of community engagement, and I'm advocating for an engagement coordinator or whatever the position may be to spend less time. So we identified, when I look back at the original needs assessment that was done with the Children's Services Council, one of the major findings was people don't know what resources are out there. That still holds true today. I go to meetings every single day, and to your point about the choir, it's the same people at those meetings. So, we've done our best through community involvement in events and sponsorships and going to the housing authority and going to churches, but we need to not just go and talk about what we do, we need to have that dialogue. So that is something that we are striving to do. We do a weekly radio program myself and our community engagement coordinator are the host, and it's not always fun doing new material every week, but we do. And its main listening audience is a section of our community that we've been trying to infiltrate in a good way, I mean. But we are constantly trying to find ways to dialogue. We have a reading initiative where we are setting up little libraries in businesses, churches, the housing authorities. And in order to do that, you have to start that dialogue about who you are, what you are, and then it leads to what are you seeing? And we've got a group of about 20 plus churches that once a quarter does community surveys for us. So they get passed out, or they're part of the Sunday program. It's a little postcard, and they fill it out and collect it. And we use all that information in our strategic direction session. But that is something that I am adamant about increasing our role, if you will, because I believe that's what makes us that will make us a better funder.
Thank you.
Let me add to that before you get to the next question. I have to say, and this I think you can benefit from as one of our mistakes. For 20 years, the Children's Services Council in Martin County was kind of the wind beneath the wings. They felt like their role was to develop and support the nonprofit community, get them configured and up to speed so they could accept these resources and manage them appropriately, give them the tools they needed to do that work. But not talk about ourselves, not talk about anything we were particularly doing to hold that system up or develop that system. Let those agencies be out front. Let the services that were delivered through these resources be out front. When we were pushed back to the ballot in 2014 to reauthorize our taxation authority, we realized, wow, we are no longer on a first name basis with our community. So we had a great deal of work to do in the 3 years leading up to that vote to reconnect, to reestablish those relationships that were there, and most of all, to get our nonprofit community to say, you know what? If you know the Boys and Girls Club, you know the Children's Services Council, because the Boys and Girls Club would not be here if it wasn't for the Children's Services Council. So to make those connections, we have 5 chambers. We were members of every single one of those chambers. We got really active with those chambers and got those chambers to understand the business model and the value to, a productive community is a community that cares for their kids, values their kids, make sure those kids graduate from high school, make sure those kids are prepared for work, make sure they're going to contribute and come back and become productive taxpayers in this community. So you can be very parochial about this, but the approach, as Sean said, needs to be in the faith community, needs to be in the business community, needs to be in your chambers. And we both spend a great deal of time in front of other people, not necessarily talking about the Children's Services Council, but talking about the value of all the things we care about, who's providing the services, and what the connection between the Children's Services Council is to the community. We have what we call Martin Cares, which is a Citizens Academy. You may have the same thing in Alachua. We go through to that Citizens Academy every 3 months and do a presentation. Mostly in our community anyway, it's retired people. Many of whom have just come here to Florida and are retired, don't know a whole lot about the community. They're in this academy to learn what's going on in Martin County. So they hear from all the constitutional officers, they hear from county government, but they don't hear about the Children's Services Council till we get there. And then we ask them a series of questions, like a multiple choice questionnaire. How many kids in Martin County learn to swim without expense to their family? Those kind of questions. So they get the connection where, well, if this wasn't happening, if the Children's Services Council wasn't funding this, our kids wouldn't be learning how to swim. So that's the key, I think, to staying connected. And you don't just do it around a vote. You do it all the time. We belong to 5 chambers. I'm on the chamber board. Sean's on the chamber board. So we connect with that business community repeatedly and speak to Rotary. We speak to churches. We speak to anybody that will have us to stay connected.
I have Herman Knopf, 2 questions. First relates to the indicators that you guys have identified that you're tracking over a long time. They seem pretty important. to help identify what your strategic priorities are going to be, but then also measuring whether or not the programs that you're then supporting are having an impact. What was the process that you and your boards went through to narrow that down to the 18 key indicators for the communities?
We'll both answer this, so give him. Well, I think you have to realize that you need consistent data to monitor indicators. So in our case, those indicators were selected based on places where we could get consistent state level, perhaps federal level data, so that you wouldn't be changing the data sets each year. I think it's important to have some consistency over time. So, I mean, everyone would like to measure everything. The other thing you have to realize is that these dollars, we can only really take responsibility for the children that our money actually touches. Community level indicators are a bit more robust than that. So there's a connection, but we can't say, except in some cases where, in fact, in Martin County, we have a birth rate of about 1,300 a year. With the program I mentioned earlier, we can touch every single one of those births. So when we're trying to get mothers into prenatal care within the first trimester, when we're trying to change things like that, we can have a pretty direct impact. But then juvenile justice rates, those larger level, community level indicators, we can help with. We can certainly monitor those numbers and that data over time to see if we're having an impact. But I think the approach is becoming more and more what I call and others call collective impact, where we partner with the community and other funders to address areas that are of particular concern.
In regards to the 19 indicators, I'm going to be honest with you, they were chosen before I got there. But it was a needs assessment from birth to 18. So to Dave's point, you know, you can't measure everything. The only thing that I would add in St. Lucie County, so Dave and I were talking on the way up about strategic planning. So for me, it's a little nuanced, and I'm getting ready to do it with my board in 2 weeks. So we as a community have something called the Roundtable. Now, I'm going to get in the weeds here for a minute. So the Roundtable consists of 30 members of the community, and they're represented by the Board of County Commission, the city mayors sit on it, law enforcement, the fire chief, the funders, us, United Way, Healthy Start sits on it, our community-based care entity, our health department. And the idea is you're either a policymaker or a funder for St. Lucie County. And that way we can create policy changes. So what we do as a roundtable is we follow the Communities That Care model, which is a risk and protective factor needs assessment that includes the same data that I talked about, as well as focus groups, and they also narrow in on targeted zip codes and stuff. And what they develop is a comprehensive plan, and we call it St. Lucie Hand in Hand. They've been doing it for 20 years, and they update it every 5 years. And then within the Roundtable, I'm sorry, and the Roundtable, just so you know, is a membership dues-paying organization. So, for example, us and the county are the highest contributors. I pay $40,000 in dues. I think they pay $45,000. But all the members pay in one way or the other, whether it be if, some of the state agencies sometimes can't fund, the public defenders on there, the state's attorney as examples, they develop a comprehensive assessment, risk and protective factors. And then the Roundtable sets up what's called networks. So we have an economics network, we have a substance abuse network, we have a health network, we have a school success network, and they develop plans and strategies that this community needs, our community needs, to move some of the indicators that we're tracking. So the idea of being a Roundtable member is that plan is my plan, right? Otherwise, why am I competing? So all of our funding supports that plan. Now, on top of that, I do strategic direction conversations with my board every 18 months to say, this is our pie, this is where our 5 categories are, 28% in keeping kids off the streets. Are we good with that proportion? What are some of the upcoming initiatives that are coming up that we're hearing through the Roundtable or the data says? So it's really kind of nuanced in a way, but we involve the whole community. Not just us as the Children's Services Council, but again, You know, we have state representative on there. We have the hospitals. We have anybody that can impact policy or funding around children's issues sits at that table that meets monthly.
Cool. And then thank you both for that. Also, the second question that I have is related to kind of sharing lessons learned. So, you know, some programs that kind of work in one location and don't work so well in the other. Do you guys have the evaluation reports or data and impact reporting information about all of the programs that you guys have funded over the years, so that a new board might be able to look at the kinds of initiatives you guys have funded and identify more promising initiatives versus ones that maybe didn't really pan out anywhere, or for, you know, in the example of the one that you guys shared where it worked in the fatherhood initiative, where it worked in one community and not in the other, that we might be able to identify some commonalities in the community to lead us, or lead the board in a direction of selecting more promise versus less.
So I'm going to answer in a strange way. I don't know if this is what you're thinking. I have the records, as long as public records, the Florida, you know, that I have. So if it's past that date, I probably don't have it anymore, but we've kind of refined our tool. If you've been to our website, we publish what's called a program accountability report. It's been tweaked through the years, but we publish it on our website, and I'm more than happy to provide at the 6-month mark and at the 12-month mark. And what it is it's a brief summary of every single program that we're funding that year, where they are financially, where they are, you know, spend out wise, where they are with meeting their contracted goals for number of kids to be served and number of adults and parents, and then where they are with the progress of their outcomes. And we've recently color coded it to be red, yellow, or green. Yellow means they're this close to meeting it. Green means they met it. Red means we've got to work with them. And as long as they're willing to work with us, we'll work with them. But at some point, we draw the line. But I can definitely provide all that.
Excellent. Thank you.
That's great. Thank you. Next question.
Hi, I'm Maureen Conray. I'm from the University of Florida Anita Zucker Center, and I just wanted to follow up on some of Dr. Knopf's questions. First, I want to say that congratulations on your indicators and decreasing infant mortality. That was incredible to look at those data and to say that I realize there are other factors that come into that number, but to know that you were able to do that and that was a priority from the start is pretty incredible. So when I looked at that data, I thought it was really telling. But I think one of the things that my understanding of these councils are that we shouldn't just give additional money to programs that are already out there that are doing the same thing. We shouldn't just fund more of what's happening or currently existing in our community, but we should work together differently and smarter to maybe collaborate around initiatives and priority areas. So I wonder if there's something you've done to help communities look at this pot of money and work collaboratively in an innovative way through your RFPs or through your roundtable to really kind of say, let's not just do business the same, but let's do business different so that we can get better outcomes.
I talked a little bit already about collective impact. Mm-hmm. One of the ways that that's been manifested in Martin County is the Funders Collaborative. We have, as you do, I'm sure, have foundations that are funding programs. You have state and federal sources. You have United Way. You have independent family foundations, or at least those are what we're familiar with. We, early on in our history, gathered up all of those other funding entities and had regular conversations, now they're quarterly, about challenges that were upcoming in the community, things that were being addressed, perhaps not comprehensively. Our county was, and I'm sure yours is now, very heavily invested in some not-for-profits. Their vision when they created Children's Services Council was taking that whole nonprofit commitment and shifting it to the Children's Services Council. Now that has taken some time, but I think it was in their case a good decision. That county government that's not their responsibility. It's roads, public safety, those kind of things. So I think it's important to realize that you have a lot of resources in your community. Our Children's Services Council early on said, we're not going to fund existing programs. We're only going to fund new programs or expansions or new things within an existing organization, because they wanted to avoid supplanting other resources. They wanted, this was a new source of revenue. They wanted to utilize it as such. And the beauty, I think, of these kind of organizations is that you can do whatever you want within reason. You can act independently. You can invest independently. I think it's important, though, not to supplant and not to redirect money that's coming to your community. We leverage, in our case, about $4 million over what we collect in taxation revenue, because we put up a portion of our money in match, and that, of course, draws down the other resources. We have a pool set aside every year to accommodate match, and that has to be somewhat available and flexible, because those match opportunities come and go based on applications for federal funds and state funds that come into your community. So setting aside a flexible pool of resources to accommodate on the fly those things that come to you that are very appealing, but there's no money for, this is an opportunity to kind of create that flexibility.
David, how much of your budget is that?
I think we set aside about $100,000 a year for that. And that can go very quickly. We just funded a match for the AmeriCorps grant to operate in our middle schools with the Boys and Girls Club. They have a 24% match requirement, $250,000. We gave them $60,000 for this year. So,
You have enough? Did I answer your question?
Were
sorry.
you going to say something else?
Real quick, because Dave, you brought up something. You know, your kind of question was, should it just be for new, or can you continue existing ones? And to me, the answer is what works, works. You know, I have examples where we have continued, you know, we've expanded Healthy Families because it's very effective in our community. That program already existed. But currently, right now, I have an RFP out to increase access to prenatal care. And we clearly stated in the RFP, at least two agencies have to work together, and it may not be a program. It may just be a strategic initiative, maybe a marketing thing, because we have pots of our community that aren't accessing services. So to me, it can be both. Just if it works, it works. If it doesn't, it doesn't. And something that Dave said, when we first started, we would fund government entities like the health department, but we had a provision in there, only 3 years, and then it was done. Well, then we're just like the federal government and the state funding. If something works and the data shows that it works, why would you stop funding it? So it took us a while to kind of get over that, you know, kind of click in our brains, but that's what we did. And that's the beauty of the Children's Services Council or the Children's Trust. You have that flexibility. And to me, the indicator on whether you should continue to funding or what gets funding is it producing outcomes? If it's producing outcomes, then that's your first barometer, in my opinion.
Thank you. Thank you. Anyone else? Lee?
Please be patient with me. I have a number of questions. Did y'all get grants? Do y'all have somebody on staff to get grants?
we tried that.
Okay.
I think it was a vision of the charter council that this money would be seed money, and then all these other resources would be drawn to the equation. I think we've experienced that. We have a pool of money we call partnership dollars, very small, $25,000 grants, maximum of $25,000 grants. Those entities who apply for those resources have to bring that same amount to the table from other sources. Those tend to be our development programs, the ones that are growing, finding their feet, moving along. We feel like that's our incubator for
What I was talking about is y'all get, and I think y'all get a certain amount of money from the millage.
Yes.
Or do y'all have somebody on staff who goes out and actively looks to see what's out there? Not that y'all are providing a grant, but actively seeks to see if there's something at the state or federal level or, you know.
Yeah, as I said, we had a person that was doing that, and Their job was essentially to help our funded organizations do that, not bring them those resources to us,
Okay.
but leverage those resources because we are not a not-for-profit. We are not a 501c3. So, in fact, we just got a grant from the Walmart Foundation. We had to go through Matt's organization, Florida Children's Council, to draw down that money.
Okay.
So unless
But
we
you said-
created a
But you said
foundation.
you had individuals, so you no longer have that
We do
individual?
not. We
Okay.
do not.
All right. Okay.
Just real quick, in 1997, when I was hired as the grants and training specialist. So I'm a little familiar with this question. So what I would do is I would identify funding opportunities and I would help them write the grant. I was not allowed to write the grant for them because, as my boss at the time told me, that there would be a line out the door, down the hall, because if you write it for them. So what I did was I would help them write it. I would, give them research. I would pull data. I would look over what they wrote, and then myself and my counterpart in Martin County, we probably trained over 1,000 people on how to write grants in a period of about 5 years.
Okay. And since then, they've had success with drawing down
Yeah,
grants?
right now, I'll be honest with you, when the recession hit, we took our staff from 12 to 9.5. And I have a person, our capacity building coordinator, that works in our program section. She does research funding opportunities, but it's not as robust as it used to be.
Okay. Ms. Conroy had said, I think the question was about building programs within the council. With the county commission, we were very blessed to have an organization a committee, the Children's Council, who was kind enough to. I mean, there were some top-notch people in child care development or child development, and they helped the commission come up with programs that were new. And to St. Lucie County, thank you very much. Y'all were a godsend to the county commission. I know that Ms. Tuck worked diligently with y'all to bring that to Alachua County, and it's been recently implemented. I know that my son was fortunate enough to see the program because he had a child recently, grandchild. And so, that's a great program. But we've also come up with two programs, one mental health based, and then working with the University of Florida to come up with a child care facility over in a certain area that's had difficulties. Do y'all have a separate entity, a committee that helps, perhaps, where you get the educators or the people that are well versed in child development to act as perhaps to come up with programs or suggestions about new programs, as opposed to funding the current programs that exist? It's kind of the same question that Ms. Conroy was asking, just asking a little bit differently, as far as having an advisory committee.
Well, and I think what you're describing, if I'm hearing you right, is sort of how our roundtable operates.
Mm-hmm.
So, for example, we're trying to address our third grade reading scores. There's a committee through the roundtable called Academic Success. One of their community indicators that they're trying to address is third grade reading. So we participate along that with the school board, with Big Brothers Big Sisters, with the library, and we're always strategizing either what policy or what initiatives that we can do to bump that up. But I will say, and I think I can speak a little bit with Dave does this as well. When we get applications in, for example, when we put a category out to bid and it's open competition, I do have an advisory committee that reviews all the proposals and weighs in and gives their scores and comments to my board to help them make their decision. And that's centered around, depends on what the category is. So, for example, when it was our Keeping Kids Off the Streets, I always involve our chamber. I involve a couple of past board members because they have experience. And then I involve somebody from the Department of Juvenile Justice, somebody from the community-based care who maybe has some familiarity. Because what we used to do is we used to gather 30 people in the community. We'd have a banker, a baker, I'm just rhyming at this point, but people that really didn't know, and you could tell from the questions that they would ask, and this isn't bad, but they either didn't read the application, or really it was whoever presented the best usually got funded.
Right.
And we can't afford to make decisions based on that, so now we get a little bit more expertise in the room.
Okay, all right, good. Currently, the commission has about $1.25 million that we're using. We've got 3 programs, or excuse me, the county has three programs, and so bearing that in mind, we know that depending upon what the board does, there's a potential that we're going to start out with a need for about $1.25 million. So I guess my question is just starting into this, what do we need as far as an organizational structure in this beginning year? So as we go forward with trying to figure out how much millage to go for, do we need to, what's, people-wise, you need executive director, administrative assistant, how much more as far as that? Did y'all, and I guess this is a discussion that the board's going to have. Is it going to be a county person? How are we going to do the HR, everything that goes along with that? I mean, how did y'all figure out in the first? And I know you weren't there initially, but any suggestions about what is the basic component of the success of this organization as you start? And thank y'all very much for being patient.
Well, I think you can start with one person, but in our case, what happened was the county loaned us an administrative staff person. She was virtually the first person to come, and the council members themselves were doing the organizational work, developing bylaws, coming up with the job descriptions for an executive director. Once they hired the executive director, his first task was to hire me because he came from Wisconsin.
Because he recognized brilliance when he saw it, right?
I don't know. He recognized a connection to the community. I lived in Martin County. I'd worked there for 13 years. I was at that time working in Palm Beach County as the child welfare director, but he had 60 applicants, so I'm blessed to have been selected from that group. But his first assignment to me was, all right, you need to draft our first RFP. You need to establish our monitoring and evaluation system. You need to do our first real needs assessment. You need to organize all of the processes around accountability, because we didn't have a financial person yet. So I said, well, that's a big job. I'm sure that we can tackle this like an elephant, one thing at a time. And what's the first thing on that list that you want me to do? The first thing I want you to do is go out and visit all these programs that we just funded and figure out how we're going to implement our process. So building that airplane while you're flying it, essentially, because the council had already decided to push $500,000 out. So fortunately, I knew probably 3/4 of those organizations already. I knew those executive directors, so I got a full entree into the door and gathered them up, and so that you can do this with 1 or 2 people. I think leadership's important. You have benefit now that we didn't have. You have 8 children's services councils that are already up and running.
Right.
You can pick their brain, and you have been. You can take whatever we have ever used, and you can look at our early documents, you can look at our current documents, you can beg, borrow, and steal everything, and we're happy to share it. So,
And we did that with the newborns, and thank y'all for helping us with that.
that's a wonderful program to
Yep.
start with, because
Yep. Yep. Do y'all ever sit down and think about an approximate percentage of what should go for preschool, prenatal, after school, what works best for the community?
Well, I think most of the children's services councils across the state have felt like primary prevention and 0 to 8 is our wheelhouse.
Okay.
That's where we tend to make investments that make a difference, and we're not stepping on the toes of some of the other organizations out there that fund deeper end services. And they're not those investments in early childhood education, for example, or in getting kids into early prenatal care are investments that pay off pretty quickly.
Right.
So.
Right. I have my own thoughts about that, and I agree totally. But
Okay.
I was just wondering if through the 8 councils that exist, if they had that.
There's some
that kind of
differences. There are, and these organizations grow up within the confines of a community, and they should. You should be driving that train, and you should be assisting whoever's in the policy-making position to make those decisions that benefit your perception of this community and what its needs are.
Okay. And the last question, y'all obviously believe in having measuring outcomes. Do y'all have, and I apologize, I didn't get the chance to look through all the information as I would have liked to, but
There was a lot there.
well, I wasn't able to access it till yesterday. So I guess my question is, have y'all noticed, and what this, in my mind, one of the reasons that because I was on the commission at the time, that I felt this was so important was that by having the impact 0 to 5 initially, it would make a tremendous difference in other aspects of the community, such as law enforcement, the number of children out of wedlock or without that stable relationship, or single family parent, those sort of outcomes. And I noticed that you did have some, as far as the pregnancy on there, but other things as far as the number of people that have to go through the legal system and those sort of things. And I didn't see that in there. Now, it may have been. As I said, I just did a cursory look. So, but I think that's, and I would hope that that's what everybody on the board is going to be interested in. How can we affect a positive? Because there was kind of the thought that we invest this money that we're going to put here, and maybe there will be something realized later on down the road. Initially, you're going to have to fund both, but hopefully, if this works, or excuse me, when this works, the ultimate outcome will be such a positive impact on the community that we won't have to fund as much. Maybe there'll be less gangs. There'll be less need for the what happens in incarceration and all the other programs that go along. Do y'all have that kind of information?
What you're talking about is community level indicators for juvenile justice rates, arrest rates, incarceration rates.
Since the program
began.
Right.
Yeah. Well, as Sean indicated, and we're bound by the same sunshine requirements in terms of record keeping, historical council packet documents are kept forever.
Mm-hmm.
But performance measured data and data attached to performance outcomes of programs that we fund, we're only keeping for about 5 years. So for the last 5 years, we have that.
Well, I guess, looking from, you've been, y'all been fortunate enough to have you doing what you've been doing for long enough. Have you personally noticed that there's a difference between what it was before and what it is now, as far as, and I know there are a lot of other factors that go into the situation, and but have you seen your community get better as a result of what you've invested in children?
Well, certainly in the area of infant mortality and prenatal care for uninsured prenatal care and birth outcomes, because we have 1,300 births, we can work with our community and make very strategic investments in that system of care. And that is the key, I think, to making community level change, is investments in the system of care, and often you have to do that with partners. Children's Services Council is one partner, and when there's community acknowledgement of an outcome that we don't like, and you get the hospital, and you get United Way, and you get the Community Foundation, and you get the health department, and you convene all of these folks around the table and say, we can no longer continue to tolerate a birth rate death rate that's such and such. What can we do about that? Or we have a number of third grade reading levels that's not acceptable. What can we do about that? So I think it's those convening opportunities, and Sean talked about his roundtable day, and that goes to the other question that was answered. How do you start to bubble up these community challenges and make strategic investments in the system of care that eventually gets to what you're after.
Okay, all right.
Thank you.
Any
Sean, do you
input?
have anything to add?
Sure, okay. Yeah, I mean, I think your question was, I think you were advocating, for lack of a better word, 0 to 5, and have we seen that down the road, kind of, right?
Well, just doing something for children in the early stages of development.
Yeah, I mean, if you look at our data and you look at the children that we serve, we are like the kings of the 5 to 9-year-olds. I mean, it's amazing to me we serve that many 5 to 9-year-olds, but we're also funding school nurses and after-school programs and childcare, so it kind of makes sense. All I would say is that, and I'm just going to use this example, you know, you can purposely target age groups, but target areas or deficits that you have in your community. And I'll give you an example. When we did our needs assessment, our teen birth rate was like 3 times higher than the state. It was crazy. Same with infant mortality. But more recent example, you all familiar with Kid Care and Healthy Kids? You know, they cut all that outreach service out, right? And then there was a shock when people weren't insured anymore. So we funded outreach services, but we weren't moving our number. And it was a source of frustration for us. You talk about, you know, how long do you stay with the program? So we kind of dialogued as a community, and what we found was it wasn't that people don't know about Healthy Kids or don't know that they can call and apply. What we found was we have a very transient community, particularly in low income. So families would apply and get health insurance at X address, and then Healthy Kids, I mean, and then depending on the age of their child, their renewal was at 6 months or 12 months. Well, they weren't at that same location. And so they would go to a health clinic and they'd be like, you don't have insurance. And so what we did was we changed our outreach service to still, you know, let people know what was out there, but it became the hotline that families could call because our outreach coordinator could call Healthy Kids, cut through all the red tape, and get that renewal happen faster than not. And so we saw our uninsured rate go from 24.7, and it kept decreasing. We got it down to like 3 point something. It spiked back up, but it's now 6 point something %. I say all that to say that
Wow,
your
that's
data
crazy.
drives where you put your money. Like if you want to change juvenile justice, you know, there are things that you can do now, and there's things, to your point, that you can do and set the stage early on. But all your data and all the research will guide you on which way to go.
And one last question. I know I said that. How much do y'all do as far as family involvement? As far as, you know, if a parent, you know, because let's face it, some of the instances are where the parent has never had the role model that they necessarily needed in order to be a good parent. So are y'all actively involved in that as well?
Yes.
Okay. All right.
No,
Good.
if I had the silver bullet to find out how to get parents involved in everything, I think, you know, I could loan you money and you wouldn't have to start a Children's Services Council. It's that big of an issue that we address.
Yeah.
But we track the number of adults and parents that we serve because, you know, if you're serving 0 to 4, 0 to 5, or 0 to 9, you know, kids don't live in condos by themselves. They have
Right.
parents and parent units, and if you're going to impact change, you have to impact the parents.
Right.
Ironically enough, we got criticized as a Children's Services Council because we served adults. And I had to make that argument that kids actually don't live by themselves.
Right. Thank you very much, and thank y'all very much.
Anything else? We're going to try to move it to the board here. Anything else from the, okay, those are great questions. Let's move it back to the board. Any questions for our panelists before we move on to the next item? Go ahead, Judge Bullard.
Thank you all so much for your time and for all of the very helpful information. What process did you each have in place before you allocated the first dollar in terms of programs? Because I've heard that you had kind of a conservative approach in terms of making those decisions, even the millage rate, but what process was in place before you allocated? In terms of an RFP process, a competitive process?
I referred to this earlier. The council themselves developed their first rudimentary RFP. I think I gave you a copy.
It's in the packet, but if you can just provide an overview.
And that was
please.
modeled after the Juvenile Welfare Board's RFP.
Mhm.
So they had 2 examples at that time that Palm Beach County had just gotten authorized, and then Juvenile Welfare Board had been around since 1949.
Mhm.
So they had a pretty robust system. As Sean talked about, a committee of community members was impaneled to review the first responses to that application. Those people were gathered up by the council chair, who was an assistant state attorney. And in the midst of that, the executive director was hired. Well, they hired a first one who didn't take the job, and they had to go back out and look. Anyway, there was a process. And he came just as those grants were being awarded. So there was no real thought given to, okay, now that we've given all these organizations money, what do we do with them? And that's why they immediately had the executive director go out and look for a person. And I was called the Director of Community Planning and Development. So my job was to go out and build that system around. And I went and visited Juvenile Welfare Board, talked to their staff, the folks down in Palm Beach County, made sure that I was, and I had some experience doing grants management for the state, so used some of those. Is that your question?
So how did the process change after you stepped in? And if so, what's currently in place?
Well, there was a whole different approach to RFP. As Sean said earlier, in those days, we were doing just general RFPs every year. So every grant that we were funding was zero-based every year, so they had to apply every year. So that's evolved. I think there's a lesson in that for you, where I think you need to let your community identify what your kind of triage, what's most important, what you really think is underfunded or underinvested in, and put your money into systems of care that will make a difference. So a more targeted approach, and instead of a general approach, or even when you identify something in particular, an invitation to negotiate with you. You set aside a pot of money, and you say, okay, we are going to award $200,000 to address this problem. Bring us your best shot.
Did you have an entire board in place prior to making those decisions?
Yes.
Okay. Did both? Did you both?
I assume so, I believe so.
Yeah, it was Lawton Childs.
Mm-hmm.
Very, took his appointments
Right.
responsibilities very seriously. Not sure that that's been the case lately, but
Right.
he, and we have had very good luck with most of our governors until recently. So,
But in terms of those decisions, they were not made until you had the whole board in place?
correct.
Okay. All right, thank you so much.
Anything else? Anyone else? I've got a list of 3 or 4.
I have some more, but go ahead.
Oh, go ahead.
No, go
No,
ahead.
let's finish.
I'd have to read my notes. and
Okay,
get my
so
glasses.
how long was your initial ballot initiative?
The very first one?
Yep.
The lead up to it, you mean?
Your-
Well,
when you first were formed.
1987, the Children's Services Council in Palm Beach County was funded. Judge Hugh Glickstein, who was a 4th District Appeals Court judge in Palm Beach County, lived in Martin County. And he wanted one in his own backyard. So he got a group of people together, Director of United Way, myself,
So was
believe
it
it
a
or not.
12-year initial or 20-year? Or?
No, well, they didn't start talking about it until 1987, and they got taxing authority in November of '89.
For how long?
Well, there was no limit on
So
it
it's unlimited.
at that time. At
Okay.
that time, the statute has since changed, but there was also the opportunity within this current iteration of the statute to put language on the ballot. So those of us who went back in 2014 wrote the language such that, and I'm paraphrasing, unless the county commission, the county board, or the legislature feels like the Children's Services Council needs to go back to the ballot, then they didn't have to.
Gotcha.
The statute indicates that otherwise it's every 12 years.
Thank you. How do you address and fund racial equity in your communities?
That's a good question. I'll just state, because I mentioned before, we have a targeted funding out right now to address, it's really to follow our fetal infant mortality review recommendations, which identified disparity and access to prenatal services and services for infants in minority communities. We put out the RFP. We specifically wrote in the RFP, tell us how you've spoken to and gotten feedback from the community that you're going to serve, that they will actually utilize this program, and then speak to us and write in your grant application the plan to engage them throughout the entire duration of the services. Not only the clients that you're going to serve, but the community that you're going to serve. So we've kind of built it into a requirement of our proposal.
As an outcome that you can measure and
And it's part of their application. If they apply to us, and actually the grants came in last week, I haven't read them yet, but if they haven't spoken to the community, to me that means that it's just a program that nobody knows about, doesn't mean that they're going to participate in. So we kind of build that into our programming, and that also speaks, I believe, to the question that you asked about we have to be, it's our responsibility to be engaged in the community, to go out, and even though I may have after-school programs, what I'm finding, for example, when we talk to all of our after-school programs, and then we talk to the kids, and then the kids have little, they kind of sat like you did and gave us all feedback, what we found was they need mental health services. But we also found is that their parents don't want them to go to mental health services. So we are strategizing on how to give them mental health services, knowing full well that they have to have parental consent, but also knowing that there's a stigma attached into it. So that, again, came back from that dialogue that we have with our providers.
And then do you have a community advisory board, and how long did it take before you, if you do, how long did it take before you?
So I do not
adopted
have,
that?
I do not have a standing community advisory board that
Okay.
meets monthly. I have a community advisory board that I use to review applications when they come in. And then in addition to that, we have the roundtable. But I do not
Okay.
have a standing advisory committee.
David, how about you on both of those?
Same thing. We have a community advisory panel that we
Okay.
impanel when we do grant review.
So they're in panel at the will of the board.
And we also use them when we do strategic planning.
And then how would you answer that, how you addressed and fund racial equity?
Well, I have to go through our history, how that's been approached. 10 years ago, there was strong emphasis on neighborhood programming. There were neighborhood family centers popping up all over the community, particularly in the CSE communities. So at that time, we were working with neighborhoods to bring them into the equation of deciding what their community needed. So we were working with community associations, and they all said, we need after-school programming in our community where kids can get to on foot. They don't have to be dropped off. They can, and so we worked with our county and our city to put those programs and strategically located those in challenging communities where the communities were asking for them. Now, this was a double-edged sword because it came back to bite us when we had a community come to us at some point and said, well, we've looked at all your data and your services are overrepresented in the minority community. You're not helping all children, you're only helping some. So we had to work on pointing to the fact that wasn't really true, that our services are here for all children. We have a system and a data system in place that will tell you down to the individual who we've served. Because that's so transparent, we could say, well, here's the actual numbers. It may look like that because we've got these centers located in those communities, but you'll be surprised to learn that in those communities, they're not exclusively serving minority children. So it was a learning experience, and that concern came to us again from the Taxpayers Association.
Thank you. Okay, anything else? Ms. Twombly?
That was my question on the data system, because we've got a lot of data coming in. And so is there a central repository you're using? Did you buy a system that's collecting all of the data, and that way you can reflect it back and show the collective impact between the programs?
Yeah, about 20 years ago, the Juvenile Welfare Board contracted with an agency that developed a funder management information system. And they leveraged that system across the state for CSE communities who wanted to participate. And that thing has morphed into SAMIS, Services Management Activity or Information System. We track all of our grants, accountability, our funding requests, our budgets with our providers are all run through that. Their reimbursements are run through that. And then we have a client side or case data gatherer side of that, and a performance measurement side. So the performance measurements are done down to the individual, and it's become more robust over the years. So most of the Children's Services Councils are participating in that system. So there's some collective approach there, and that's certainly available to you.
That's good.
Anything else, Joe?
No, I love the way that you've set up your priorities in your strategic plan, because it's very clean. It, it goes through and says why it's a priority and what could impact the priority. And my understanding is that these priorities stay in place for a 5-year, or the programs stay in place for a 5-year period. Have you ever adjusted the priorities during the 5 years, or is it just within those priority areas you change where the focus may run?
So we have the 5 categories. We rotate them around. I explained this on a phone call with somebody from Alachua County the other day. So we have 5 priorities, the 5 that I mentioned. The making sure every baby's a healthy baby is actually a system of care that we've kind of created, or at least plugged in essential pieces: the kid care outreach, the nurse home visitation, the brain program. So our board, when that category came up, we kind of started with one and we kind of rotated through. When that one came up, they looked at it and said, look, and we dialogued with them. We said, look, this is a system of care that we've created. Like, who's going to provide the nurse home visitation if it's not the hospital? So with that input, they actually did not put that category out to bid for competitive bid, because they said, this is a system of care that you've created. And again, this speaks to the flexibility of the Children's Services Council model. But what they did do was they identified the weakness, or what the data wasn't going in the direction that we wanted, which was access to prenatal care, particularly in minority communities. So we put out a targeted funding opportunity. That's the one that's out now, that just came in. And once we identify who we want to contract with, they will become part of that system of care, and then we're going to start our rotation all over again. So typically they will put a category out to bid, but they do have that flexibility if they don't want to put it out to bid, or if they want to have a planning year, for example, they don't want to put any of them out to bid until they go through their needs assessment, or their strategic plan. They can do that, but that's an example of kind of that flexibility.
And I like the fact that you allow a program to run 4 years, because I don't think if we just funded year to year that it could truly become what it's going to become in that time period. You talked a little bit about when you determine a program's unsuccessful. What does that look like? Because I'm assuming you want to be very even-handed between programs, so that it doesn't look like you're picking on one program versus another. When do you decide that it's time to stop funding a program?
We have decided that on several occasions.
Sure.
Typically, as I referred to earlier, programs start with us as a partnership grant, very small. Have to bring their own resources to the table. They get into a development approach. They get their legs under them. That takes about 3 years. Then if everything is looking good at that point, they can move into our competitive cycle, provided it lines up with their priority. And once they do that, as long as they're meeting their performance measures, and those are negotiated annually, even with our continuing contracts, there's an opportunity to negotiate those based on our experience. If they're falling short they have to meet, they generally have no less than 4 performance measures, generally more than that. They have to meet all of those measures at a 75% rate. So if they're falling short in any particular area, they have to come to us with a performance improvement plan. Some people call them corrective action plans. We're trying to be positive. So those are performance improvement plans. They have to identify the factors that contributed to the underperformance, indicate whether it was within a system that is in their control or outside of their organization. For example, Healthy Start had one that I can recall that required all babies born in Martin County to sign up or be offered Healthy Start services. Some of that was on the system in place at the hospitals, and the Healthy Start organization was a little too far removed from that. They could do what they could do with the Medical Record Administration office, with the nurses that were on the floor, that were talking to parents, but they didn't have direct control over that. So identify what they can control and what they can't. If they go into a 3-year period where they're underperforming, and that would be significantly, where they're missing on 2 of 4 or 3 of 4, then they go into a conversation with the council, and in some cases no longer get funded. But that's a 3 or 4 year period. Most of the programs that have that happen have other system challenges in place, and it's not just a matter of our funding. They're also struggling on other fronts.
Thank you.
Sure.
Okay, any other questions from the board? No? Okay, I think I can't thank you both enough, not for all the stuff you provided in the past, but for giving us your afternoon and for the future calls from many folks from Alachua County. I think we need to give them a round of applause. All right, moving on to our next item is the children representative from Florida Children's Council, Mr. Smart.
Mr. Chair, we have Matt Goose here today from the Florida Children's Council, and a lot of this number of the questions that came up, I'm sure he'll be ready to address and provide some very helpful information. The Florida Children's Council, I think you heard earlier, a number of children's services councils around the state, and we're talking 7 or 8 are all members of the Florida Children's Council, and so it is a very valuable resource for the trust as well as for the other Children's Council. He also have a staff person with him, and we'll let him introduce her too.
Mr. Goose, welcome to Alachua County. Thank you for hosting us in Tallahassee.
Good to see you again, Commissioner.
Nice to see you again. You have the floor.
Thank you, Commissioner Board. Thanks for the opportunity for us to come talk about what the Florida Children's Council does. Obviously, you know, we respond to lots of requests, and we send you lots of paper, but it's more important than that. Before I get to that, though, you need to know the person who is really kind of the dean of our organization at this point. Allie Jones is our association coordinator, so she is really the point of contact when you send the requests, the questions. She is reaching out to our members, and within a week, as you can see, getting a lot of good information back. So she's a critical part of our team, and she may jump up. I'm still the new guy, I guess, in the office. Do you want me to, we have a presentation?
Please, yeah,
Okay.
go ahead. I'm sorry we're running a little late.
No, that's all right. I want to be respectful of your time.
Yeah.
So I kind of just, I'll start
Before
by...
you get started, members, are you okay to go past 6 tonight? Yep, okay, yeah, go ahead. We're looking for about 6:30. That's okay. Shoot for that. Go
Okay,
ahead.
great,
Yes.
thank you. So we are an association, and our membership consists right now of 7 and hopefully 8 of the CSCs throughout the state of Florida. We live in Tallahassee, we work in Tallahassee, and a lot of our focus, even outside of the last 60 days, are what goes on in Tallahassee. Being at the Capitol and in the capital city is incredibly important for this world that you're about to enter into. Because the idea of special districts, there are laws that govern you all, and we are there to always make sure that we are on the front line of those discussions. I think what also is very exciting for me, being fairly new to this, is the idea that as children's services councils, we have the unique ability to engage our policymakers on policy. We don't need to go and necessarily ask for a bunch of funding. So when we enter a room and talk about policy, and as a member of our association, you will be part of creating that policy, it is about what's good for children in the state of Florida. And you all will have enough to do here in Alachua County, just like our other members have more than enough to do in their communities. And that's where we can help. We can take your visions of a state for children in the state of Florida that's good, and we work on that year round. And we have lobbyists that we engage that are very prominent and well respected. But we talk about policy, and coming from the early learning world, not having to ask about money and funding, it's kind of refreshing to be able to say this, we do this because it's what's right for children. We also communicate regularly with our members, and really anybody. We post a weekly legislative update. Perhaps some of you all have had a chance to see that. It's very popular. I think we have a number of people that subscribe to that, but we could customize that for you as well. We have relationships. Last Monday, I met with the governor's appointments director, specifically about Alachua County, and trying to make sure that once session passed this Friday, hopefully, it will all be done. Once it's over, their commitment to us is that Alachua's appointments will go to the top of the stack. They realize this is incredibly important for you all. So we will continue to use that relationship. She is a wonderful lady who's in charge over there, and I think that the relationship will be good for us going forward. So we'll continue to work on that for you to make sure that you get your board and can really start doing all the things that need to be done. We also, being at the state of Florida, we've got access to obviously the state agencies and those sorts of things. For example, going to meet with Secretary Popple here in the next few weeks to talk about the Family First legislation. Everybody wants to know about Family First, but we have those relationships, and obviously you have your local leadership who are experts, but we also have the ability to work on your behalf with agency heads in Tallahassee. And then the other thing that we're doing, this is very exciting, just kind of a one-off. Colorado just actually passed legislation around the only other state in the union. Florida was the first. Colorado, this last legislative session, has passed the ability to leverage property taxes for the creation of children's services councils. So we work with other states. We work with other communities. I keep telling my friends in Leon who are working on developing their children's services council that Alachua is the model you need to follow. You got to move slow, but you got to move with directness, and you got to move with a purpose. So you all may be the recipients of requests a year from now from Leon County. So we'll look forward to hundreds of pages of paper from you as well.
Happy to provide.
Let me see, do I? So we just provided an example of our capital connection. This is just a way, Allie, to her credit, will go through at the beginning of the session, and if she finds a bill that has the word child in it, she catalogs it and then tries to track it. But we also work on issues that might be specific to Alachua County. Our Palm Beach CSE called us and said there was a very Palm Beach specific issue that was going on and asked us to follow it, and we went and met with members, and so we are there to kind of deploy. But as a council, as being part of the council, you all will develop the legislative priorities that myself and Allie will go to the Capitol and work on behalf of the state of Florida. And you may or may not know this, but the CSCs are the second largest funders of children's programs in the state of Florida, next to the state, to the tune of over $500 million a year. So this is no small group of people when we talk about policy. The legislators understand, especially those ones that have it in their community, are very supportive and always willing to help us. This is just an example of kind of our public policy brief that we'll work on, or public policy agenda that we'll work on with all of our members every year. We'll be doing it in July this year. We'll have our lobbyists from Ballard Partners come and join us at our retreat in July in Daytona Beach at the Hard Rock, which is, we'll talk a little bit about the retreat, but kind of debrief about what happened and really give us her insight on what it's going to mean to work in the legislature in the upcoming year. As we know, school safety, Hurricane Michael, there are a lot of big issues that were in the legislature, and us knowing before we go into that environment where the focus is going to be really helps us make wise decisions, and that's where our lobbying partners can certainly help us. So the other thing that we do, and really this is kind of what we've been working with Claudia and Tom on, which by the way, you've got two great staff, and I'm sure you already know that, is the idea of shared resources and networking. You know, it is, I've really come to respect the fact that you all are essentially going to be running government. And you've got enough to do with whether you have 10 staff or you have 100 staff. The reality is that's busy work, and it needs to be done and focused on. So what we can do in our office is when you have a question, and by the way, it's just not the new communities that ask questions. Almost on a weekly basis, some of our oldest CSC communities are, can you send us examples of RFPs in the area of X? And we go out, we collect that, we package it, and we send it off. So we really are kind of see ourselves as that central point, that one call you need to make instead of 20 calls potentially to find the right person. And again, we talked about our access to expertise, the staff that we have. We're working on a web-based platform, which we're really excited about, which will house a lot of these materials. So the idea being not that we don't like collecting all of these things for our members, but wouldn't it be nice if there was a web-based portal where you could say, you know what, I'm interested in teen pregnancy. Let's see what RFPs are out there in the CSC world, be able to search a database that way. We want to build that for our members to make sure that it's as user-friendly as possible and accessible. Social media and communication plans. I think Dave talked about it. You know, CSCs, they've been doing really fantastic work in their communities for a number of years, but have flown below the radar in large part. And we think there's a really important story that our responsibility as the council is to tell, and that state of Florida needs to understand that the $500 million plus being invested in children by Children's Services Councils is something worth talking about. We don't have to be the best kept secret. I don't subscribe to that. So one of the things that we are also working on is a new social media and outreach campaign to the rest of the state, because while CSCs may not work in every community, there's a lot of communities out there that it will work in, and we want to make sure that everyone out there knows what you all are doing. We talked a little bit about the retreat. That's where we bring in keynote speakers, areas of expertise. We just sent a survey out to our members. What do you want to know about? What do you want to learn about at a retreat? What issues are real important to you right now? So we'll bring in outside experts, and we'll spend 2.5 days meeting with folks, having good discussions. You all are a relatively small, you're entering a kind of small fraternity here, right? I mean, so not everybody else in government will understand what you're going through other than the folks who do what you do. So an opportunity for us to come together a little bit like we did in Tallahassee in February and talk about the things that are really important to you all, the uniqueness of what it means to run government, to run a Children's Services Council or a trust. Great choice on the name there too, by the way. I love trust. And then, of course, we always are looking for ability or opportunities to bring in industry experts and other speakers to really benefit you all. That can be, we do a regional meeting where we try to bring together maybe some of the smaller size CSCs. That's something that we plan to do, and talk about what it's like to have 11 staff in each of your offices versus, you know, Miami and Palm Beach, who have they're fortunate to be able to have 60 or 70 people, but it's all relative, right? I mean, those 60, 70 people are working extremely hard, just like 11 people are, but there are differences there. Right. So we want to be kind of the avenue in which we can convene like-size CSCs and have really specific conversations about what's important to smaller communities versus large communities. Just example, we also house, we talked about grants. Someone asked about grants earlier. The Florida Children's Council currently has grants from the Mott Foundation for the Florida After School Network that's housed within our office. The Helios Foundation, which is the Florida Grade Level Reading, is housed within our office. We have grants from Kellogg and the Kresge Foundations looking at 2-generational poverty and trying to soften the fiscal cliff associated with a lot of the subsidy programs that families are working in. So we've got some research going on in that area. So we definitely go out and we try to find grants so that we can also do some research on the side that's valuable to our membership. Our goals, I've kind of hit on them, but directly make the lives of children, make a difference in the lives of children by strengthening and expanding the work and the mission of CSCs, advance a prevention and early intervention public policy agenda at the state level, and create additional partnership opportunities that strengthen the work of the council. And I won't read these word for word, but when you look at kind of the 3 goals that we put in this packet for you all, strengthen and expand the work of CSCs, advance statewide public policy agenda, and create additional partnerships to strengthen the work. Those 3 really are at the core of how we define ourselves. It is to be a resource first and foremost to our members, and anything that we can do is what we're committed to doing. But at the same time, because I walk 2 blocks to the Capitol, I can walk 2 blocks to work, to meet with policy members, and you know, if you're familiar with that process, you can't go once every 2 years, right? I mean, it is a constant, and it's not necessarily the members, right? It's the staff who are in Tallahassee every day of the year that you develop the relationships with. So it gives us an opportunity to really talk about policy. And I really like that aspect of the work, is doing what's right for children because it's right. Not because any one of our organizations stands to get an extra dime. It's what's right. So that's very exciting. And then the partnerships, whether it be with state agencies, other nonprofits, other associations, finding those folks like they do locally to take the combined effort and really focus in and bring more people to the table when we're working with policymakers. That was the quick version. It's been a joy, and I mean that sincerely, working with you all. You're asking the right questions from what I can say. You're requesting the right information. I have no doubt it feels overwhelming. I've never been in your seat. I can't pretend that I have ever been in your seat. But do know that that's what our association does. whether it's the buildup and getting you to the point to where you're ready to write those RFPs, or it's 15 years from now when it's time to write different RFPs. Our association, that's what we want to do. We want to be a support for you. And with that, I'm happy to answer any questions you may have.
Okay, thank you. Any questions?
Very helpful.
Questions? Okay, well, I just got to say on behalf of, I know Ms. Tuck and Mr. Smart, everyone in Alachua County, certainly myself included, the Dorothys who are constantly calling your offices. The Dorothys are responsible for the name, the trust part of the trust part of the name, in talking to our community, because that's really what the whole ballot was about. Allie, to both you and Matt, thank you so much for all you do and will continue to do. We look forward to being a member.
Thank you.
Okay, let's move on to the next one. Members, the next item is information received from other Children's Services Councils. Mr. Smart?
Mr. Chair, in addition to the information that you have from St. Lucie and Martin County, you've got other information in your packets, including information from Manatee County, from Miami-Dade, and from Palm Beach. Valuable information, we think, on organization setup, use of consultants, et cetera. And so hopefully that'll be very helpful as you move forward.
Any questions, members? Okay, let's move on to number 7, list of data sources.
Number 7 is a listing of data sources provided for your review, and we've got a number of assessments that were done by other organizations in the community. We received approximately 17 responses from different organizations, and we think that a lot of these will, some of these may be valuable, may be helpful in your looking at the issue of needs assessment. Again, we think that the gap analysis that was commissioned by the Children's Services Advisory Board has been deemed adequate to meet the standard that is imposed by the statute. But we may want to do more targeted needs assessment, and some of those responses are targeted to different areas of children's needs. And so we just want to make sure that the board is informed of those assessments.
Okay, members, any questions about those pages? I saw kind of a summary, haven't gotten into the details yet. Any questions? My comment, just for y'all's benefit, is I certainly believe when we get into our budget deliberations, we'll need to be spending a lot more time on the needs assessments for 6 to 18, and then honing in on 0 to 5, the existing programs and the data that's already been provided. I don't know if we need another to expand on that, but we'll see what the full board says when and if it gets appointed, or when we get into having to make those discussions. Okay, Mr. Smart, let's move to item 8, initial budget and budget workshop.
Mr. Chair, we talked earlier about having a draft interlocal agreement for the board to consider at the next meeting, but also we'd like to have we're looking at having a work session, if you will, a workshop on budget. It's going to be very important that the board is able to put together a budget and have it presented to the Board of County Commissioners by July 1. That requirement is part of the statute as well as part of the ordinance. We've been looking at a couple of dates. Mr. Tonkovich has been doing a survey of the members, and so we've had some. All of you are very busy, obviously, in your other positions, other responsibilities, and so we wanted to see if there's a time that we can do a budget workshop or extend the meeting to allow for more in-depth discussion on budget. And Mr. Tommy Crosby is available and will be available along with Todd Hutchison, our Chief Financial Officer, to help lead that discussion.
Okay, and so also it looks like in your staff recommendation, you've got additionally staff recommended that the trust invite the participation of the 15 gubernatorial nominees in the workshop.
Yes, absolutely.
So walk me through how you envision that working, and then we'll see what the will of this board is.
And maybe I'll let Mr. Crosby come up too, but I envision that we could present a draft budget for the consideration of the board, so you can look through that budget and see if it addresses the needs and priorities that you feel are important in year one. Basically, we're talking about fiscal year 2020, fiscal year running from October 1st of this year to September of next year. And so what are the priorities? Are we going to be meeting those priorities in that budget? And Mr. Crosby can help outline staffing needs as well as priorities, as well as RFP and purchasing arrangements, legal, all of the services that you will need in order to get going next year. And then you could have a question and answer session and just roundtable discussion, including the 15 candidates, nominees from the governor.
Yeah, so when I think of workshop, I think of brainstorming session. I think of no action. I think of getting ideas out on the table, having just kind of a free flow of ideas as opposed to like, and then from there, taking that feedback back to this board at a later date and giving specific policy direction about developing the budget. That's what I think about from a workshop perspective. Tommy, what are you thinking? And then let's hear from the members with regards to their thoughts.
So we're here, obviously, to support, which there's a lot of foundation building that you need to work on. Unfortunately, May 20th, I'm not available. I'll be out of the state May 20th at that particular meeting, but I have plenty of staff available to assist with that type of activity. I would encourage that. I think when we originally set out the calendar, we talked about at the last meeting, the 2 meetings in June were sufficient to formalize the budget, if you will. So if the board needs time to do some brainstorming and to talk about priorities and from a budget prep standpoint, it's more of a technical document. Again, I would anticipate most of those dollars going into operating expenses for contracted services. The determination of whether those are going to go towards 0 through 5, through medical, through home care, whatever, all of that does not have to be determined by July 1st. That's not a requirement to get a budget passed. The budget's going to be very much more technical. It'll all be basically what people are you going to have, what are you going to contract for administrative services, what are you going to keep in your reserves and your fund balance, very numbers-oriented, account-oriented detail. The actual bulk of your money, $5.5 million or so, what millage levy you're going to set, obviously that is a key component. But that bulk of those dollars can be set aside in contracted services or other services. And then when the full board has been seated, then you can go through and decide what age groups are we targeting, what types of programs are we targeting, how are we going to go about identifying who was going to provide those services to us, are we going to do an RFP? All that can be determined later. That doesn't have to be done to generate that budget document that goes to the board.
Okay.
The main thing is setting the funding level of what you want to have in year one and some outside parameters. So what we can do is send you probably some basic financial policies, which would be good for you to look at and to adopt, like setting some reserve limits, setting some ideas of how you want to structure that stability of the funding and where it's going to go. And then we can build the budget in June fairly easily from a legal standpoint, if you will, that would pass. I would advise taking your time, making sure the programs are what the 10-member board want to do, and that's going to take some time. That can't be done in one brainstorming session. So it's good to get started with that, to talk that out, but I'm scared you're going to spin your wheels a little bit till the other 5 are seated and you start talking about, now what is our objective and what are we trying to accomplish? So from a technical budgetary standpoint, it's much less than what the true budget is and the programs that you're going to run.
Okay.
So I think it's more about how you're going to deliver administrative services and some of the outlying guidelines of the budget.
Which some of those decisions we've kind of already given
Right.
some direction on. Judge Bullard.
So July 1 is the date for the tentative budget, and then the final budget is due when?
So you have to deliver your budget before July 1 to the board.
Right.
And the millage levy you're going to set, we'll adopt resolutions at your last meeting in June, actually is when we'll adopt it, so that we can send that to the property appraisers,
Right.
that you can add it to the trim bill. You'll go through the summer, and then we've set the dates in September. I think the 9th, I can't remember off the top of my head, but the 2 meetings in September is when you would finalize and actually adopt the final budget. Again, they would still be at a very broad operating expenditure level, contract expenditure level. You don't have to have the programs in your budget per se. It doesn't have to be program by program. Eventually, next year, you're going to have that out there. You can do budget amendments during the year. So if you get during the year and you want to change it to a grants type program, a grant award program to some things, if you want to You need some procurement policies to go to, you mentioned before. Are we gonna compete these through an RFP process? Are we gonna identify programs where we know the single provider is out there and we wanna negotiate directly with another government, be UF or somebody like that? So there may be varied ways to get the services you want, and that can be done throughout the year in the budgets that you're creating now without a lot of pain. So I don't want you to get dug deep into the program level stuff.
So is there a desire for us to expand any of our meeting dates to have like a workshop format? Or is it the will of this board to just keep our dates and times as we schedule? Commissioner?
I'm in favor of the workshop format of their coming, since I'm new to this.
Okay.
And I have ideas. I'm not sure about the rest of you all, how you would come, but so that we don't get jammed up, I'm afraid if we do May 20th only, that we may not have enough time to share ideas and do what we'd like to, do what needs to be done. But I'll go with the will of the board and come prepared to work. I mean, I have my ideas, but I'm not sure what's gonna come out, and to be vague as Mr. Crosby said.
Okay. I had a discussion, I guess the other reason I brought up this workshop idea is I had a discussion with Pat Gleason at the state with regards to the sunshine laws. And she actually recommended that since we can't have interaction with our potential appointees, that in order to get the input from the potential appointees until they are ultimately appointed, that having a workshop where they can speak, a noticed workshop where they can speak freely about what their priorities are and how they are viewing the current programs and potential programs, and the administrator, that might be a forum where we could have some interaction back and forth other than, at the dais in a more free-flowing format. So I'm in favor of a workshop if we can find a time that works for everyone, or extending the meeting times of what we already have scheduled. I know our staff has reached out, and the 13th and the 20th seem to be dates that have conflicts. But first, before we decide to find a date, let's see if the majority of the board wants to have a workshop. Haven't heard from, you do? Okay. Karen, you do? Okay, so I guess what we should do is move that staff try to find a date that works. Or Claudia, do you have another suggestion? You said the 13th and the 20th have issues with our existing board.
That's correct.
Are there other potential dates that we could look at?
It seemed like the difficulty was particularly while school is in session, with a lot of school activities for particularly the superintendent, extending the meeting or going beyond.
And that was my only option on the 20th, was to extend.
So if we had a workshop on the 20th, we start at 4 and we did it over at the health department, and we said like 4 to 8, would that be something that is acceptable to this board?
On the 20th, yeah, I don't have anything else.
Superintendent Clark, are you, go ahead. Yeah, you're on.
Potentially have to leave slightly early to get to a school, but we can make that work.
7, you could be till 7-ish?
Yes.
Does that work for you, Judge? So without objection, would it be okay if we ask staff to go ahead and schedule at the health department our next meeting in a workshop format? And we'll inform the appointees, and if they could make it, that would be great. If they can't, then maybe they could send their notes through staff, and at least we can have some dialogue back and forth. And I think that would be really, for my benefit, certainly very, very helpful. And I think from there, then we can start to develop, I think, a preliminary budget.
So I would ask that maybe think about and kind of talk about how you're going to develop that workshop in terms of, there's really, again, 2 components. And one that's probably going to take a lot of time, a lot of discussion, and direction is going to be the program side.
Right.
That's the bulk of your funds. So we're going to have a lot of input from the people that are interested in the program. That's why they're all here, is about the programs and what we're going to be doing, not necessarily the administrative monotonous stuff that we do in our budget cycle and the things that those guidelines, if you will. I think that's a much smaller component of it and can be handled a lot less time. Some basic decisions about, again, funding level, about reserves, about policies and those kind of things, and how you're going to do the administration. Are you going to contract, do the interlocal agreement? Some of those kind of structural things need to be decided separately from programs. And
I agree.
Programs could last a long time. Discussions would be a lot larger discussion.
Yeah, so we've got some lights. Is that an old light, Superintendent Clark? Okay, Mr. Smart?
Mr. Chair, we're just going to note that certainly we'll be, staff will get together with Mr. Crosby before the 20th to make sure that we identify those issues that we want to address during the budget workshop, and then we get that information out to the board, including the 15 nominees, so you can review that prior to. So we want to make sure that we're focused on that workshop and be as productive as possible.
Yeah, so you have already given us kind of that template of if we
Yes.
hired a director and a financial person. And so I think we have kind of a template already. The big part of that, though, is the programming.
Right.
And so I think the free flow of ideas with regards to our existing programs and future programs, if we want to continue them, which we may or may not, with our potential appointees, and then that's the expense side, but then the top side is the revenue side. Do we want to start out with just funding programs, or do we want to start our millage out at a higher rate? Because you use the full half mil.
Yes.
This board may want to do that and develop reserves, or it may not. It may want to do the opposite approach, kind of like Martin County did. And I think that policy discussion amongst all of us will be important for us to have a free flow of ideas back and forth so that you can then go from there.
Sounds good.
Does that make sense? Any other discussions about that? Does that make sense? Let me open this up. Any discussions from the public about that? All right, you have, without objection, some direction. Let's move to number 9, which is our trust member administrative and public communications. Mr. Smart?
Mr. Chair, we've been looking at the issue of how those citizens, how those the nominees, governor's nominees, how do people communicate with the board members. And since you are in the sunshine, and as our legal staff has advised you and advised us and advised staff, we want to make sure that we're in compliance. I'm gonna let Claudia talk about, we've looked at a couple of options, and we also have IT here in case you have any questions, IT, on how we would set up an email system so that there can be that direct communication with the members of the board and still be in compliance with the sunshine requirements. So we'll start with Claudia, and then we may have IT come up particularly if there's any questions from the board.
Thank you. Currently, we have a web page on the Community Support Services page for the Children's Trust, and we have a Children's Trust at alachua.us. And we've had requests from the public to have direct access to you, because currently the Children's Trust, any emails go to that. Tom then forwards that to all of you. So we've had, again, requests for individual communication. There's a variety of ways we can do that. We can add each of you to the existing page and your contact information individually. We can add a grouped email, so that would go to all of you at one time from that page. Or we can purchase a domain where we are separate, and that will be the start building a Children's Trust domain. There's a little bit of urgency in making that decision, because our IT department has been searching some names from those we suggested, and already one that we searched is in the midst of being negotiated for purchase. It seems like when you start looking, people start buying. I think it happened to some major companies. So what they have currently looked at is Children's Trust AC, and then that they would always buy .com, .org, and .us, or Children's Trust Alachua County, again .com, .org, .us.
Okay, is IT here?
Virgilia is here.
So what would, in consultation with Bob, our attorney of Sunshine, what would you recommend we do to get in compliance and allow the public to reach us directly and communicate with us?
Yes, good evening. My name is Virgilio Bensamoya, Network Manager for the Alachua County. Our recommendation is to keep it separate. okay, for you to have your own website, okay. About the email addresses, what I suggest is to use the same domain for email addresses. So you will have all your email for the Children Trust on the Children Trust website and on the Children Trust email, okay? Not combined with all your email, you come from very different agencies. So my suggestion is to keep it separate. It will be transparent, subject to all the public records request regulations that we have. And in this case, at least initially, it can be managed by the county IT department, unless you decide something different. And that's my recommendation.
Okay. So so I guess I'm looking for a motion if the board agrees that move that staff develop a separate website that allows for public records compliance with trust board emails, or something like that.
Can we give you a little bit of information, just because you guys can have our website?
Okay, yeah, 1 second. I don't think we want it, but we may want it, but, so we have a compliance thing and then we have a communication thing. And so I think what we're trying to figure out is how we can get in compliance, and at the same time, we may also want to merge in the previous website. So we're not determining a name, we just want staff to bring us back recommendations on getting us in compliance, and then we can work with whoever we need to work with to bring back the specifics. That sounds good. So I've got a motion and a second. So now let's hear from the public with regards to your thoughts on what we could do or utilize from what is already out there.
So I was the chair of the campaign, Dorothy Benson, for the Campaign for Children's Trust. Our domain name is actually childrenstrust.alachuacounty.org. Happy to hand it over to you. You can take the whole thing down, create whatever it is you need if you'd like to use the domain. Just wanted to let you know that.
Thank you.
Okay, that's very nice. Thank you. Dorothy T.
No, that was it.
Oh, that was it. Okay.
I just wanted you to know that we have a Children's Trust website that you can have. We're happy to give it to you.
All right, so I think the recommendation is to work for staff to bring back some recommendations to this board with regards to what we can use, what's out there. If we can utilize what's already there, that's great. Something simple that allows for us to have our own separate emails at the county commission. If someone wants to send somebody to all the emails, they just do BOCC at the extension, and I'm sure you have similar type things. But then county staff will have all those records for public records requests and so on and so forth until the trust has our own IT. All right, so we've got a motion and a second. Is there any further discussion? Anyone else from the public? All those in favor say aye. Aye. All those opposed, that motion carries. Okay, next item is call for public input. This will be an opportunity now for anyone from the public to bring forward thoughts, comments, or issues before this board that's not on the agenda. You don't have to come all at once, but we would love to hear from you if you have thoughts. We don't meet enough, I know.
I just want to read you a few notes that I made while you all were having your meeting.
Thank you.
I just wanted to tell y'all to be bold, to be creative, and to be innovative, to take as much community input as you can, and to please go out and seek it. To respect the taxpayers, absolutely, but also respect the voters that approved a $500,000 and want you all to go and fix our county's really large issues and our disparities. I'm speaking as an advocate and one of the people who campaigned for this. And I would like to see you take all the money so that you have maximum flexibility in terms of adding programs and funding your reserves, and so that you can, the money will be there when you have consensus. You can fund programs for the older kids, and to create the innovative system of care that can change the trajectory of our community's children. And that's it.
Thank you, Dorothy. Anyone else? Dorothy T.
One thing that I think you guys might want to keep in your big picture mind as you're going towards this budget workshop, I think obviously the first and most important thing you guys have got to do are the nuts and bolts, the executive director, the financial people, the whatever. But also keep in mind that if you are going to choose to fund the existing programs, that the county's fiscal year ends, in September, so that
30th.
those programs fall off a cliff at the end of that funding cycle if they're not already funded. So although there's not a statutory requirement to fund them urgently or in a particular time frame, keep in mind that they stop when the money runs out. So that may be something you want to put on the second priority of discussions that you start having when you have your budget discussions after the nuts and bolts stuff, before you get into the bigger, giant, what are all of our various funding priorities and whatever, just because you hate to see that $1 million that we've spent on building these programs up just go to waste because they have to stop, and then the programs start all, particularly like the nurse home visiting. It's not like there's a secondary funding source for something like that. So if the funding goes away, then that program stops, and all of this consensus and collaboration that they've built in disappears, and it would have been kind of a waste of money that we put into it. So
I do
Thank
have a question, Ms. Thomas. Have you all been in discussion with the county concerning continued funding?
no, I think it was 100% the intention of the county that once the Children's Trust was created, that would supplant any of that funding and that board would go away.
You all, the county, though, is on the same timeline as we are in terms of funding?
Yeah.
Okay.
Yeah, and I would agree with Ms. Thomas's statement. The county was very clear that by October 1st, they were not going to continue that, but if this board wanted to, they would.
But
Yeah,
you all have
and-
not submitted your budget yet,
No.
the county?
No.
Okay.
No,
No,
but, and
no.
I think that, that's the way the contracts were written, so that one could parlay right into the next if that's what you guys choose to do. So I think it will be an easy, should you guys decide to continue those, it'll be an easy, there won't be a lot of paperwork or things that have to be done. You've just got to decide if that's what you want to do or not.
Thank you.
I know they're watching. They are, they're watching. They're watching what this board says.
Okay. Just a quick hello. I'm the co-president for the Pride Center of Community. I'm sorry, I'm nervous. The Pride Center of North Central Florida.
Thank you for being here. Don't
Absolutely.
be nervous. You
I
take
just-
your time.
This was an amazing meeting. I learned a lot. I love that there's so many people here supporting this, and we are actually actively looking for funding for programming for LGBTQ youth. So there's not a whole lot of stuff out there, and I just wanted to let you know that we are definitely here. We're growing. Our Pride Center is actually getting a lot more vibrant. We have a great board we're trying to build ourselves. And I just wanted to say that I'm here. We're paying attention. We're a part of this community. We love this community, and anything that we can do to be part of this and to help out or support in any way as well. I just wanted to let you know that we were here.
Thank you.
Thank you.
What's your name? I'm sorry.
Oh, I'm sorry, Minette Chesarak. I'm the
Okay.
co-president.
That's Cheswick. Thank you. And May 20th, please come.
I already have it on my calendar.
Okay, wonderful. Thank you. Next speaker, please. Anyone else? Okay, let's move to Children's Trust Advisory Council Gubernatorial Nominee General Comments. This is a time for you all, if you want to add anything. We can't talk outside of this, so, okay. Is there any comments you want to give us? Appreciate you all being here. Amazed, actually, at the constant attendance. Thank you. Shows you how great Alachua County truly is. All right, general board comments. Got anything, Joe?
No, I think I said enough for
Okay.
I just thank everybody for coming.
Yes, sir.
This just amazes me, the enthusiasm for this, so I'm excited to see where we go over the next few months.
And I know no one will believe it, but I have no questions or comments.
Whoa. Oh.
Thank
Well,
you all.
no,
Thank you all for coming. Honestly, no, but and thank you the gentleman that came and did the presentations for us and sharing the information. It was a lot of information to read, and the questions that I had actually were answered in a lot of the paperwork the documents that were shared, and then in your presentation. So thank you all for driving up. I know how that is for one day, and thank you all for the other prospective appointees for asking questions, because a lot of the other questions that I did have were in there. So I appreciate you all contributing, and I am impressed as well with the input.
Okay, Judge Bullard.
I'm just looking for some guidance. So for individuals or agencies who have questions about funding because they know the money's going to be there at some point, how should we respond to that when they say, I'm looking for money for this program, for that program? What process do we say we have in place? What guidance do we give them in light of the fact that we're discussing funding, and there are 3 other programs that have already presented to the trust
Ms.
and
Tuck?
made that request?
You have a suggestion? I had a similar call today from someone with Planned Parenthood that was saying, how do I get on your agenda? And I said, we're actually, great question. We're having a meeting today.
I think that's part of your needs assessment gathering as they identify what services they provide, what gaps they see. I think that's going to be an important part of gathering the full needs assessment information.
And so just for clarification, at this point, our needs assessment addresses 0 to 5, and that was 2016. And I think Mr. Logan addressed that at the last meeting, that maybe we would need to make some changes to that. But at this point, we do not have a needs assessment for 5 to 18, correct?
No, Ms. Tuck?
You do have the gaps analysis that was developed by the Children's Services Advisory Board, and we did share that with the Florida Children's Council. They did feel that that was a preliminary needs assessment that you could make some initial decisions from if you chose to, and then go from there to maybe identify some key areas you see in the gaps analysis to do a more in-depth needs assessment.
Mr. Smart, did you have something to add?
Mr. Chair, just want to add that I agree with what Ms. Tuck has said. I think additionally, as you go through the budget workshop, the answer will become clearer as you decide what programs you want to be looking at doing in fiscal year 20. If you decide that you want to do new programs, then you may do a call for proposals or RFP. Or if you decide you want to just start with the existing programs that were developed through the Children's Service Advisory Board, that kind of a decision will drive what kind of a process you'll have for asking for and requesting proposals for different programs. I think right now is the best advice is for organizations that are looking is for them to come, as I'm sure a bunch of them already are coming and listening and watching, and then at the appropriate time, this board can decide how you want to request those proposals. Right now, they should just be watching and developing and getting ready to go.
Good. Okay, do you have anything, Karen?
I'll just echo the sentiments of my colleagues. Thank you all so much for coming. It was really, really great information. And there's a lot of it. I mean, we're used to big board packets, some of us. And, but it was some really great information. And again, thank you for some of the great questions, because I had some notes for questions and they were asked by other people. So, or it was clarified within the information, which is always nice when you're assuming what our questions will be already, and gave us a lot of great information. So thank you again.
Yeah, and I'll just conclude by saying, Sean and David, Matt, Allie, thanks for being here. And for all that you have already done, we really, really appreciate it in Alachua County, and we will be glad to help the next community that's interested with understanding kind of how we went through things and share what we shared. Some things that you said, Sean, what works. I think that's kind of resonating in my mind. Do what's right for children because it's right. And I intend, when we get into the budget, I intend to try to be bold, like some of the folks have said. I think there's so much that we don't know, but I want us to be ready. And this community says so many of the right things, but ultimately we have to fund what our priorities are. And so fund our priorities. And so those are my thoughts. Again, I appreciate everybody being here, participating, and I look forward to the workshop over at the Health Center at our next meeting on May 20th. And with that, we're adjourned.